Hey guys, so I just want to go over my curriculum design with you. So my topic was taking new graduate nurses in the pediatric population and teaching them about diabetes in that population. So I think just as a new grad, I didn't know much about diabetes, and we randomly saw it throughout my time at my old job. And I just felt that I just didn't know enough. Like, I was like, am I giving the right amount? Am I giving enough units? Am I counting the carbs correct? So I think that this is really helpful because diabetes is a big part of our lives. Even in adult world, it's huge. Um, so I think knowing the proper management is great because, sometimes even if your kid comes in for the flu or respiratory stuff, it could affect their diabetes, and you have to know how to manage that. Um, so that's kind of why I chose this topic. So I found an article that said from 2002 to 2012, there was a 2% increase in type 1 and a 5% increase in type 2 among the pediatric population. I totally could see that. Kids are less active nowadays. And with type 2, it's a sedentary lifestyle. They're not being active enough. You just don't have the proper diet that's affecting it. And type 1 is genetics. So that makes sense that we would have an increase of about 5% because we are seeing more obese children nowadays. So the course will take place over 8 weeks. I wanted to incorporate some online stuff too because I know sometimes, I know back in the day I did not focus on lectures and stuff all the time. I mean, sitting for 3 hours watching a PowerPoint, I just couldn't do it. So I did, go home and utilize online resources to help me learn. So I wanted to incorporate that as well as in-person learning environments for these students. So when I started creating my curriculum, I wanted to include patho of the disease, proper medication, safe med administration, proper education for both patients and families, because with pediatrics, you see a wide range of ages. You could have a 5-year-old that you're going to teach, or you could have a 14-year-old that does not want to take their meds. So you have to learn how to educate. You also have to learn how to educate the families, which some could hold higher educational degrees than others, and so you have to learn how to kind of present the education to them so that they'll understand. I also really want to focus on community resources because diabetes is a lot. There's a lot that goes into it. It's a lot of money. It's everything. So finding these resources for these families is going to be really helpful. The design model I wanted to use was ADDIE. I think it's really great. You just analyze, design, develop, implement, and evaluate. It definitely helped me create my curriculum. I made sure to analyze my curriculum, making sure that's what I wanted. I wanted to create the design. I developed that design. I want to implement it, and then I want to evaluate and make sure it's going to work. The learning theory I want to focus on was adult because, back to the learning theory I want to focus on was adult learning because they just take like their past experiences and they want the information to be relatable, and that's how they kind of learn. And I feel like this is just the way I kind of learn, so I thought it'd be a good one to use. So with diabetes, you're going to have a lot of team members. You're going to have a nurse, a doctor, diabetic educator, endocrine doctor, and probably social work involved. So I think just knowing who's going to be a part of your team and what resources they can provide is going to be really helpful. So then I went back and wanted to revise my curriculum. So I decided to just do a review of patho and a review of the meds because I feel like new graduates should already have kind of a basic understanding of that because they just got out of nursing school and have learned about it. But I also want to take this time, like I will give them a quiz, and if they're not understanding those concepts, I will review it further because it is a lot to it. So here's my course outcomes. By the end of the 8 weeks, you need to explain the patho of both type 1 and 2, differentiate the two types, explain the medication, mechanism, action, side effects, and route for both types, identify proper education for both pediatric patients and the families, and explain resources available. So I did the 8-week course. It's a day 1 and a day 2. Sorry about that. So day 1 and day 2. So the beginning, day 1, I want to do my patho refresher. Day 2, I'm going to continue that because it is a lot. I wanted to incorporate my whole outcomes and stuff or my whole curriculum design, I wanted to incorporate different learning materials. Because me as a learner, I learn better hands-on or video. But I know there were some students in my class that liked the PowerPoints. So I think just having all these different opportunities is good, like PowerPoints with open-ended questions to get the group discussion happening, and this will also trigger adult learners because then they can kind of speak up and explain their experiences with this type of stuff. I love games. I think games are so much fun. And they kind of challenge them. They kind of question things, so they have to, use their critical thinking. And videos. I love videos. I think they explain things really well, so I think utilizing that will be really beneficial for my students. So I also, every week I have online study guides, reading assignments, and practice quizzes for them, so they can do it on their own time. And it's not mandatory, it's just if they want to. And then I kind of just list my outcomes for each week. Mainly the outcomes just focus on what my topic is. Like this week is patho stuff. So week 2, we're doing medications. We're doing medication charts and cards. Again, videos and games and stuff like that. I think the medication charts and cards are nice to create because they kind of have you lay out things, and then these new grads can look back at these medication charts and cards and make little ones and keep them in their pockets so they have it, which I think will be really helpful. So each week I have a quiz just to make sure that they're understanding the concepts. If not, we will review whatever needs to be reviewed. So then week 3, I think it starts. Yes, week 3 they're going to start on day 2, following a diabetic educator. I assume I'll probably have assignments for them while they're following the educator, but I don't want to overload them with paperwork because I actually want them to focus on what the educator's doing. And I feel like with paperwork, sometimes we just focus on that, try to get it done. So I want to be able to, I want them to be able to actually follow the educator and learn from them. And I want them to kind of switch up educators because people do things differently. So I think that's really great to see how everybody does it. So then week 4, we're talking about proper education for the patients. So again, like I said, you're going to have a wide age range. So you have to learn how to talk to them. I mean, a 5-year-old, you're not going to be like, hey, we're going to give you the shot, You have to, figure out how you're going to explain things, how you're going to show them. Maybe rewards after doing their shots will be really beneficial for that age group. Teaching them techniques. And then when you got a 14-year-old that doesn't want to take their meds and is like, this is dumb, you have to figure out a way to explain to them why it's important they do this and stuff like that. Then week 5 we go into family education, which is really important because they are the ones that are going to have to try to help monitor this. I know a lot of the kids that I saw, it was because they weren't being monitored. Their family thought they were teenagers, they should be able to do this on their own type thing, and just didn't monitor it, and those kids got to the point of they just didn't take their meds or wasn't watching what they're eating and stuff like that, and that triggered them to be in the hospital. So I think a family is a big support group for these patients, so they need to have a big understanding of why doing what we do for diabetes is so important. And then week 6 we get into resources available. I think this is a huge thing. We need to understand the resources that we can help our patients' families with and our patients. There's so much that goes in diabetes. Learning about the equipment, learning about the meds, learning about food and diet, everything like that. So I think that's really important to know where your resources are so you can help your families out. This week I also incorporated guest speakers because like I said at the beginning, diabetes just takes a whole team. So I wanted to bring in a social worker, a diabetic educator, an expert nurse that's been working in diabetes for a while, and a doctor, just to give them different backgrounds and stuff, and kind of understand the nurse's role in diabetes and the doctor's role in diabetes and the social worker and the educator, stuff like that. And then week 7 is kind of just a final review of everything because their finals coming up next week, so I want them to review everything. Lots of different incorporations, study groups, questions, videos, PowerPoints, games, everything. And I forgot to talk about earlier weeks, I want to do simulation labs. I think those are really important. I think getting the hands-on experience is really good. I think the weeks that I did it for was for the education weeks because I want them to be able to go in, you know, have a situation, have a different age group of patients, take them, treat them, and then have to go over the education aspect. And I think by this week, they'll have been following the educator for a little bit, that they'll kind of have tips and tricks to help educate their patients. So I really think simulations are great. And one of the students said having reflection after them is going to be really beneficial, which I totally agree. I think reflection time after simulation labs is so important because when you're kind of in simulation lab, I feel like you kind of focus and you're like trying to think of things and use your critical thinking skills. But after you kind of can relax and you're like, oh yeah, I should have done it this way, or oh yeah, I did that awesome. Like I didn't even think about it, but I did it great. This is perfect, and stuff like that. And it's a good time for me as the educator to give positive feedback as well as critiquing them a little bit. Like, hey, maybe next time you can do this or that, you know. But I think it's a great time, and it also like allows the other students to kind of understand things too. Because I felt that in simulation lab when I was the observer, I picked up on so much more. I was like, oh yeah, they could have done it this way, and it would have totally made a difference and stuff like that. So I think it's a really good opportunity for students to learn. So then week 8 is just the final exam, and then I will obviously send out their scores and the answers and stuff to them so they have it, and then I will give them time to ask me any questions. So then I kind of just talk about the ADDIE model and how I utilized it to create my project and every aspect of it. And then for evaluation tools, obviously I'm using the quizzes to evaluate their knowledge, but I also think incorporating, like I said, the reflection evaluation at the end of simulation will help, but also having the course evaluations throughout will be helpful. Like, am I meeting their learning needs and stuff like that? And if not, you know, how can I tweak this course for the next group? So I think that's how I'm going to evaluate mainly. The main resources I'm going to use is obviously a book, information on diabetes. They're going to need computers. I'm going to need a computer to create PowerPoint presentations, research articles, access to simulation lab, Word documents to create case studies, as well as study guides, and software to help create quizzes. I also am going to have to reach out to diabetic educators and make sure I can create a schedule and evaluation paperwork to make sure that the nurses are meeting the requirements. And then I think that's mainly it. I talk about, you know, utilizing the adult learner, doing the group studies, giving open-ended questions is going to utilize discussions where they can take their previous experiences and be like, this is kind of how I've seen it and done it. And it might be beneficial for the other students, and they might pick up on tips and tricks to help. So that's mainly it. I mean, my main goal is just to get a better understanding of diabetes, and I know that the orientation process isn't super long for new grads sometimes, so even if I have to cut it down to like a 5-week course or something like that, I still think it'd be really beneficial for these new grads. I know the new grad residency programs kind of, you pick a topic and you make a presentation, but I think that would be a good time too to like maybe have review sessions over things that they find. Also, like in the residency program, giving them time to be into their job and like seeing things and being like, hey, I don't remember how to do this, but too afraid to ask, they could always ask in that program so we can give them guidance. Because new grads have it hard. I mean, they're in a new situation. They're trying to remember everything. And, you know, I just think having support is going to be the best thing. Having support, knowing that we were all new grads at one point, is going to be beneficial to them. Like, don't be afraid to ask. We all don't know everything. It takes time. So that's about it for my project. I can't wait to hear your guys' feedback, and I can't wait to see your guys' project.